Well, the dramatic spread of COVID-19 in China is leading the U.S. and several other countries to require COVID testing for passengers from China. The U.S. says one of the reasons is concern over possible new variants. And joining me now is Dr. Neha Narula from Stanford Health Care. Thank you, doctor, for joining us again. So China has largely been in a bubble until now, and it's unclear how reliable its data is. So what is the likelihood that there could be a dangerous new variant spreading there?
Indeed, Ryan. We know that anytime we see an overwhelming surge of cases, the virus has been given ample opportunity to mutate or undergo a recombination event to become stronger and a more resistant version of itself. Thankfully, though, so far no new variant has been identified across multiple agencies. GSAID, which is a global repository of genomes of many different viruses, including COVID-19, has confirmed that the data samples that have been uploaded in its database from China all the way through December currently show that there is the variants that have been identified resemble what we know the current variants that are globally make their way around. Additionally, the World Health Organization has also been thoroughly reviewing and analyzing publicly sequenced data, and they too have not found any mutation of known significance at this time. And Italy actually independently has been testing passengers arriving from China into Italy, and they also have been testing positive COVID-19 samples and have not identified any new variants. As always, we are learning in real time. The CDC has expanded their traveler-based genomic surveillance program, and the EU also has recommended that individual governments like Italy carry out random airport testing and then examining positive samples as well as waste from airplanes that are landing in Europe. Again, this is a developing matter, so we'll certainly be keeping a close eye on this and updating our viewers as we know more.
And you mentioned as people traveling to Europe and they're testing there, do we know how effective those travel restrictions have been historically in slowing the spread of COVID?
You know, that is a fantastic question, Ryan. At this time, we've seen several countries like the US, the UK, Canada, Qatar, India, as well as countries in the EU. They have reintroduced these requirements, and some, like Italy and Japan, are requiring testing upon arrival. Unfortunately, though, even though these restrictions intuitively seem like they're protecting us, studies actually show otherwise. These strategies are not successful in preventing spread. A study that looked at the original restrictions in China did show that it did help slow down the progression of the epidemic, but only by a mere 3 to 5 days. And then when you look at international travel restrictions, the spread, as we know, since the start of the pandemic in no way was prevented. COVID-19 made its way around the world. But yes, it can slow it down by days to weeks. The same study actually also showed that mitigation measures such as early detection, household quarantines, hand washing, masking, these are actually more effective than travel restrictions themselves. So understandably, countries want to keep their citizens safe, but the science just isn't there to support that travel restrictions actually help prevent the spread. They do help slow it down, but the prevention is not there.
And the vaccination rate in China is relatively low, and so far, and the country has been using vaccines produced in China. So how do those vaccines work, and are they as effective as the mRNA vaccines? And could we see them allowing some other vaccines into the country?
Yeah, so at this time, there are about 8 or 9 COVID vaccines available and have been approved in China, and almost all of them are based on older vaccine technology. Sinopharm and CoronaVac are the most commonly used ones, and they use inactivated viral particles within their injections that, once injected, elicit an antibody response in people that have gotten these vaccines. Originally, they were reported to be about 50 to 60% effective against the earlier strains of COVID, and these trials were conducted in patients under the age of 60. However, you throw in new variants into the picture, studies looking at and comparing these older technology vaccines with the mRNA vaccines that we have just show that these are not effective. mRNA vaccines are more effective at eliciting a better T cell response, a better antibody response. they are more effective at preventing COVID-19 entirely, as well as reducing the risk of severe illness and death. Um, Additionally, researchers in Hong Kong confirmed that 2 doses of CoronaVac were actually almost ineffective against New York's Omicron subvariants. There was very little antibody response mounted, whereas mRNA vaccines such as Pfizer and Moderna have actually mounted a significant antibody response against these newer subvariants. At this time, the EU and the US have offered mRNA vaccines to China. However, they have been refused. Um, However, over the weekend, China did report that their own Chinese pharmaceutical company, CanSino, is conducting trials on their own new mRNA vaccine that has shown early positive results against the Omicron variant. So hopefully that will be available to the Chinese population soon and can potentially help prevent severe disease and curb future surges in China.
Well, always good information. So Dr. Narula from Stanford Health Care, thanks for joining us.
Thank you for having me.